Hi guys, and welcome back to this section, and today we're going to be talking about falls, back injuries, spinal injuries over the next couple of minutes. So basically in Ireland every year there's about, they say 2 to 3 per an Irish Examiner's report back in 2019, 2 to 3 spinal injuries per day happen in Ireland. This is my version of the spinal cord here. As you can see, made out of a few biscuits and a few bits of sweets. So if you imagine these parts here, this is the vertebrae, the disc, and so on and so forth up along. As you can see, it's highly flexible. It can move forwards, backwards, it can shift around the place, and that allows you movement every day of the week. So what happens as you get older, or maybe due to injury or disease, what happens is some of these spongy parts start to wear away, and as a result of that, if you take them out, the bones will hit the nerves, pinch the nerves, and that can be very debilitating for a lot of people. So if you notice this as well, look, if I squeeze, you can see how much that squeezes down, and the human body will squeeze that way as well. So you have to be very careful, especially about injury. So if I get injured, we'll just say for argument's sake here, around where the middle of my chest, we'll just say for argument's sake. And as a result of that, from that point below, I can be injured. Now I've dealt with a lot of spinal cases over the years, and the most important thing is when you're dealing with these patients, be very calm and do not start moving them and start pulling and dragging at them. Because if they're involved in sport or a road traffic accident or any kind of fall, leave them on the ground till the professionals come. You won't have the equipment to deal with these patients, and these patients have to be handled very, very carefully. We're going to talk about that in a few minutes. So as you can see, yet again, it moves around quite a bit. Excellent. So let's move it on a small bit, then let's talk about an injured spine. Then we'll just take a small section of it here. Now if I turn it around, you can see some of the disc is missing here. So as a result of that, when you come down along, look, and you press here, you get them two meeting together, and that's wear and tear. And if you look at some of my other videos I talked about, when two bones meet together, that's very, very painful. And if you're sitting at home with a standard back injury, you know how debilitating this is. Even for the simple things of going out, getting up every morning, getting out of bed can be life-changing. Can't hold your kids, can't work, absolutely debilitating things. So be careful, you only get one back, lads, so be very careful about it when you're looking after it. When you're dealing with back injuries like this, obviously you must see a doctor, you must get your x-rays done, your CT scans, MRIs, whatever it is, meet your physiotherapist, and they can do lots of great stuff with it nowadays. So the whole thing is, yet again, is if you watch this again, look how easy it is to squeeze down. So you imagine like you're standing up in a ladder, you're up in a scaffolding, something like that, and you squeeze down. And this is a very, very common call within the ambulance service as well, when you're dealing with spinal injuries. So people fall, disease orientated, different stuff. As we covered in some of our videos in the past, we have a small bit of trauma going on here and there, and we're going to talk about that in a few minutes. But the thing yet again is that if you have a simple fall at home, falling off a chair, falling onto your bum, and the next thing you get a sudden pain in the back, don't move the patient. Keep the patient relaxed on the ground, keep the patient warm, observe the vital signs. Coming up in the next few weeks, we're going to talk about vital signs and how we put them all together, and whether we can establish whether the patient is big sick or little sick over the next few weeks. Dealing with a patient, we need to know what's after happening in the body. So remember I mentioned a minute ago when we talked about a spinal injury happening around the chest, and from that point below you would lose all sensation, all movement and all that. And it's classed as a distributive shock, and distributive shock is basic really. So what happens is when you're looking at the body on a normal day, we have a nice tone to our body and keeps everything as it should be. But the problem with distributive shock, you end up with this, the same amount of water, but it becomes a bag of water. Dealing with a patient with a spinal injury, remember we talked about a second ago, what happens is your body becomes a bag of water. So what happens when the person lies on the ground, you get this distribution of fluid around the body. And as a result of that, what happens is then that you'll find that the blood pressure may drop, the heart rate will drop, because remember, it doesn't have to push it right back up the hill like it did a few minutes ago. So in some cases, what you'll find below the point of injury as well, that initially that the person is warm. So you'll find that, we'll say if they're injured at their belly button, below that the point gets very warm because all the blood drops down to the lower half of the body. As a result of that, then you'll find that you have a low heart rate. Maybe the breathing rate is a small bit lower as well, but the most important thing here is don't panic. Thanks very much for looking in this evening, guys. Just a quick synopsis on that, but keep an eye out for further videos. We're getting more in depth as we go through the weeks now. We're going to put all the stuff we learned over the last 12-13 videos together, and we're going to do a patient assessment for the next day. By the way, thanks very much for your support this year and all the support and all the nice comments. Happy Christmas, and I hope you have a very, very safe Christmas. Thank you.